prepare a suction setup. I didn't pull out the suction, so as long as you know that when you do set up your suction, you're setting it between 60 and 80 for neonates.
60 and 80 for neonates. I can always watch this video again. Unless it's on here.
And then select the proper endotube size. So if they're less than 1,000 grams, utilize a 2.5 millimeter endotube. So they're over there. That's a 2.5.
That one's a 3.
Okay. So when we intubate this one, we're going to use a 3.
This one's a 3?
No, this one's a 3.
No, I know. I meant like for this.
Oh.
When we intubate this one, we'll use a 3.0. But preemies, you use a 2.5. 1,000 grams, you're going to use a 3.0. Keep it sterile as possible. Usually an uncupped endotube is used for neonates. The cricoid cartilage is a narrow enough ring to provide a seal around the endotube. There are endotubes available that utilize a cup for infants and pediatrics. So if they're intubated for several weeks, usually their cartilage in their trachea gets really soft. And there's a big leak around the endotube, and they end up, first they'll try a bigger size. If that doesn't work, they'll try a cup. And then select the proper sized laryngoscope. A Miller laryngoscope blade is used for neonates. The Macintosh is not used due to the angle of the neonate's tongue and airway. 00 is if they're really small, less than 1,500 grams. A 0 is used for neonates larger than 1,500 grams.
Just in case anybody wanted to remember. Okay.
And then when you intubate, you hold the handle down low. Like you don't hold it up at the top, you hold it close to the bottom.
Oh, yeah.
You have more control of it.
Okay. So that works.
Okay?
So we don't have anything that goes in?
Correct. No stylet is used with a neonate.
Okay. And then on these?
And then you're going to secure it with a neo bar or...
How do you secure it on this one? Usually, because I know the other one you have like a wrap.
Is this tape?
Oh, so we don't use these.
Yeah, you can use, Joe DiMaggio uses that, Broward Health uses that.
So what?
And then there are different colors. This one's white and yellow. So what you do is hold this in the middle of the nose and go to the ear and see what color it is.
Okay, and that'll be what color anchor pressure you use. So we technically don't have either of.
No.
Anything else I gotta?
Yeah, I want to see you pre-oxygenate with the Neonate.
Oh, the Neo.
He's the Neonate. Oh.
This thing again.
So small.
Isn't it tiny?
And this is a flow of what again? With the Neonate, I know the other one. This is 5 to 7 too.
Yes, you can use 10 liters per minute on these mannequins.
Okay.
Intubate, you should have a good seal.
So don't, like, I can try this afterwards is what you're saying?
Okay.
Okay. Because, yeah, it's inflating, but why wouldn't it?
It's not reaching pressure because there's a hole in the esophagus.
Okay.
Oh, so that's, okay. So you're saying this isn't my fault this time?
It's not
Okay. Never intubated a baby before. Tape,
It's so tiny. Or
yeah, so you can take the mask off and try to ventilate.
It's a little high. It's ventilated.
oh, you got it? Yay!
Yeah, looks like it's in the right spot.
Yay!
Yeah. Okay, so then
And is it reaching your peak pressure this time?
it's reaching 15. Still only at 15, what would that mean? If it's like, because that doesn't mean this is in the wrong place, right? Because it's still going to the lungs.
Right.
So what would be another reason?
Could it be a leak or?
It could be a leak.
So do I just keep doing
You're good. So now you can secure it.
it doesn't matter which one I use at
Let's
the moment?
pretend we're hooked up to the ventilator.
So would it go this way? Like that? Or would it
Yeah.
go this way? Or I guess it doesn't matter.
It doesn't matter. Seems like a little big.
It doesn't really move. That tape came out. Would I do it like that?
Mm-hmm.
Looks good.
Yeah, it sure does.
Cute little baby.
And then,
All right, and then for the inline suction catheter, a couple things. You remove the adapter that comes on the endo tube. And you're going to put one of these on.
so the same one that we
And it
had.
says the size.
What is that? Just an adapter?
It's an adapter for the inline
Oh.
suction catheter.
Okay,
And then it has an opening for the ventilator circuit.
got
So
it.
it goes like this.
Okay.
And then
Yes.
that would be the suction. What it goes in here?
Ventilator circuit? Or
That makes sense.
bagging.
Okay.
And there's colors on the inline suction catheter. Do you know the reason for the colors?
Is that to let you know, to match it up with how far down it goes?
Mm.
Yeah. So when you're suctioning, you don't hit the carina. You want to stop at the end of the endo tube. So how are you supposed to know where the end of the endo tube is? Well, if you match up the number on the suction catheter to the number on the endo tube, then you're at the same depth.
Okay.
And you match it at the same time, like 13 to 13 is here?
Yeah, so you can match 13 to 13, 10 to 10, whatever numbers you can see that's not taped up.
So if I was going, like say if I, oh my god, this thing's so tiny. So I would do blue. So the blue would go like right here. If 13 was here and this is 13.
Yeah, if you have 13 on both, then you're equal distance.